Okay, good afternoon, everyone. Here you got Dr. K here this afternoon, and today's subject we're going to be talking about opioid withdrawal and opioid detoxification. Okay, so get moving right along in this video. For all the practitioners who have viewed this video, it's very important that before you begin to counsel your clients and your members, it's important to read and familiarize yourself with their psychosocial and their biosocial before you can begin to counsel them, so that you be able to familiarize yourself with their background. And so what we're going to do is begin to start about talking about the different kind of opioids. You have prescription opioids and you have illegal street opioids. Prescription opioids are tablets, such as Vicodin, oxycodone, and other different types of opioids that people abuse. And then you have illicit and illegal opioids, such as heroin and synthetic fentanyl. And as you all are aware, here in Michigan, we have a fentanyl crisis where individuals abuse synthetic fentanyl. And so we're going to talk about opioid again withdrawal, the effects of opioid withdrawal and detoxification. Okay, now in these particular facets of detoxification, we're going to talk about medicated assisted treatment. And there are different medications that are used to assist individuals who are interested in detoxing from opioids, such as Suboxone. And that is a medication used to treat opioid addiction. It contains active ingredients which are a combination of biofrin and noxolone, meaning that these are medications that bind to the neurotransmitters in the brain so that individual can begin the withdrawal and detoxification process. There are other ones that are called biofrin, which is a synthetic opioid medication primarily used to treat opioid use disorders and moderate to severe pain. And then obviously we have the traditional one, which is methadone. And also that is a synthetic opioid medication used primarily to treat the opioid disorders. Okay, so the big question with many of the patients, they want to know, what is it like to go through withdrawals, to go through detoxification? And the best way I can describe it is you're going to feel like you're about to die, but you're not going to die. Okay, you're going to go through withdrawal symptoms, such as joints and pains, insomnia, not being able to go to sleep. You're going to have other issues like thermoregulation, where you're going to be sweating. You're going to be able to have fevers and chills. And again, these are very miserable feelings that you're going to experience, but they're going to blow over. You're going to have a restlessness, not being able to sleep, tossing and turning, anxieties, and some others. Now, again, many people want to know, how long will this last? Well, there is no set time period about how long it will last, but it will end. But typically it lasts anywhere from 3 to 7 days. And once those 3 to 7 days are expired, then you can look forward to coming out of the withdrawals. But it also depends on some other factors of things about how long have you been using opioids, how old you are, what is your general physical health, what were the substances, what is your sex, the route of administration. For example, was it intravenous or was it intranasal, or were you taking it by mouth? And what is your general physical health? So these are some of the issues or some of the concerns that will arise in detoxification that will determine how long the effects will last. Okay, so that 3 to 7 days is what is called the acute phase. That is the beginning stage of withdrawal. The clinical terminology that is used for the professionals is opioid abstinence syndrome. That's the same thing as the acute stage. And again, people want to know how long will it last. My general response to that would be anywhere from 3 to 7 days. It could go from 2 to 9 days. And it just all depends on some of these factors I listed before, such as what substances was used, how long you've been using these substances, were you using a substance since you were a child, now you're an adult. Again, so yeah, all of those are factors in how long in the acute stage will it last. Again, so in the effects of these of the acute stage, like I said, it's insomnia. It could be vomiting. It could be sweating, thermal regulation. You under a blanket, taking the blanket off. And so it's a very, very traumatic experience, but you're not going to die. It's going to blow over, and you will get through it. Now, there are other parts of withdrawal, and that is the long term. Now, I just described the short term. The short term is just what I just described. But the long term effect is just that. Now, and patients ask me, how long will the long term effect? The long term effects is a little bit different than the short term effects. The long term effects, that is where an individual is likely to relapse. But obviously the hope is that the individual will not relapse. And during the long-term syndrome of withdrawal, detoxification, whichever you want to call it, the professional clinical term is called the protracted withdrawal. Yeah, protracted withdrawal syndrome. Again, it's the second stage of detoxification. And there's a taper line for that as well. And individuals like to know, well, how long will that last? Well, that one is a little bit more complex because it involves psychological changes in the brain, dopamine levels in the brain, metabolic rates, dysphoria. You have euphoria and as well as dysphoria. Dysphoria is something that is a little bit different than euphoria. Dysphoria is something I would describe dysphoria as you have your mood swings and you're coming back to reality. Whereas with euphoria, you're on this get high, you feel good, you're tripping, whatever you want to call it, some of the street terminology in euphoria. But dysphoria is a little bit different. Also in the long term withdrawal, you begin to have changes in your blood pressure, your mental acuity. Also, you come back to reality about how maybe originally, how did you even get on drugs? Some people got on drugs simply because of family dynamics, abuse and neglect, and you began to use drugs. Okay, well, during the long-term effect, you begin to come back to those realities, and again, and it could be an altered dopamine in the brain. Okay, so those are the two main detoxification and withdrawal. But there's another one called rapid detox. This is one that is kind of new, and it is controversial. And this is basically a situation where the patient go under sedation, go under general anesthesia, okay, and the doctor shoot them up with Narcan. It's a very expensive. It's, like I said, it's controversial, and most insurance companies don't pay for it because it's expensive. They'd rather for you to go through the detoxification process that I aforementioned and go like that. And many of the professionals feel like people should go through the traditional detoxification and traditional withdrawal forms of detox because it will remind you of what you went through if you were to relapse. Okay, and so, but with the rapid detox, that's kind of quick. You just don't really experience. You go to sleep for 2 days, you wake up and you're through with detox. Okay, and so also remember, once you go through the long-term effects of withdrawal and detoxification, there's some things that you could be doing to make sure that you do not relapse, such as maintaining a healthy diet. Yeah, it's important to maintain a healthy diet, not eating a lot of junk food, which we all do. But for someone who's in long-term detoxification, it's important for them to remember to maintain a healthy diet, eating wholesome meals, your fruits and your vegetables and so on, and maintaining exercise regimens, such as walking, such as exercise, whatever your choices of exercise, whether you go to a gym. And you can maintain a healthy wellness program for yourself while you're going through detoxification and withdrawal. Okay, so that's about it and everything for now. I may come back and do another video talking about other forms of detox. And so that's that.